their weight is a sensitive issue, but using body mass index to profile people with excess weight is not a very good idea, studies have shown. This is not to say that excess weight doesn't carry consequences, but BMI alone is not a very good measure of cardiometabolic health. So what are we talking about? A large study published in the Archives of Internal Medicine examined over tens of millions of people with normal weight, overweight, and obese, and found that body mass index alone tended to mischaracterize 24% of persons with normal weight, 51% of people with overweight, and 31% of obese persons. So blue and red shows persons with normal and abnormal cardiometabolic profile. So if you look here, using BMI alone, 24% of people deemed to be of normal weight had abnormal cardiometabolic parameters. This basically factors that increase your risk of heart attacks, stroke, diabetes, and premature death. At the same time, 51% of people who are overweight, otherwise deemed unhealthy, had normal cardiometabolic profile. At the same time, 32% of people who are obese, that is BMI above 30, others considered unhealthy, had normal cardiometabolic profile. Now, this has implications in terms of public health. Now, a separate study also looked at the relationship between cardiorespiratory fitness and death in persons with normal weight, overweight, or those who are obese. The risk of death in normal weight persons with low cardiorespiratory fitness levels was higher than in overweight and obese persons who had high cardiorespiratory fitness levels, as shown on the left. Now here's what I'm talking about. So if you look here, you can see individuals with normal weight, others considered healthy, who were unfit in terms of cardiorespiratory fitness, were twice as likely to die compared to people who are overweight, here in yellow, who are overweight, and people who are obese, but who are otherwise fit in terms of cardiorespiratory fitness. So the primary goal of physical fitness for exercise should not be to lose weight, but to achieve cardiorespiratory fitness through 150 minutes of moderate intensity activity 5 times a week, including at least 2 days of muscle strengthening activity, or 75 minutes of vigorous intensity physical activity 3 times a week. Now, moderate intensity activity is typically defined as brisk walking, cycling, a bicycle, or running up and down the staircase, typically characterized by fast breathing, but the person is able to talk. Vigorous intensity activity, on the other hand, refers to aerobic dancing, jogging, running, swimming, or cycling uphill. It's characterized by fast heart rate, fast breathing, but difficulty talking. Remember also that if you're going to exercise, also minimize the amount of time you spend sitting or being sedentary for long periods of time. So what are the public health implications of this? First, cardiometabolic profile refers to a combination of many factors such as waist circumference, elevated level of triglyceride levels. This is a type of fat which is found in blood and which tends to clog the arteries, leading to a condition called atherosclerosis that predisposes to heart attacks and stroke. It also includes low level of HDL cholesterol, the good cholesterol, elevated blood pressure, as well as elevated fasting plasma glucose level, which can lead to diabetes. As I said, these 5 risk factors increase the risk of heart attacks, strokes, as well as diabetes and other conditions. So when you have 3 out of 5 of these indicators, we say that you have metabolic syndrome. Now, it's not that these risk factors on their own will not increase your risk for cardiovascular disease, diabetes, or stroke, but having any 3 out of 5 increases your risk of heart disease 5-fold and the risk of getting diabetes 2-fold. Now, losing weight is still important, but it should not be the primary goal of cardiorespiratory fitness. Simply losing 5 to 10% of your body weight improves your blood pressure, your serum cholesterol, as well as your blood sugar. Now remember, it doesn't matter whether your BMI is 40 or your BMI is, let's say, 28. Losing 5 to 10% of that weight has significant benefits. Now, this content was brought to you by Kike Afia Happy Birthday Wellness Quiz. My name is Subiri Obogo. I'm a medical doctor and specialist in public health medicine. We rely on well wishers to bring you this content, and you can support us by subscribing to my YouTube channel, liking, as well as sharing. For those who have been asking to support us in other ways, you can use the M-Pesa till number 766500 or the M-Pesa mobile number 0720 95 82 50. Thank you very much for listening. Please watch out for the next upcoming videos. Thank you.